Hello, hello. We are back. I'm Diane, and this is Lisa Wessel with
Hello.
Encompass Women's Health. And today, before we start talking about anatomy, female anatomy, I just want to give you a heads up that we will be using appropriate terms. If you have little ears listening, you might want to stick your headphones in. Be sure to like and subscribe. Today, we're going to talk more about the vagina, specifically what happens when you age. I was telling Lisa, I Googled it, what happens to my vagina as I go through perimenopause and menopause, and it described like this. It shrivels up, it dries out, it becomes flaky and very delicate. And I had to double check that I wasn't reading a description of a pastry. So Lisa, what's going on? Everything is sagging now. It's not
Everything
just
I
our
know, it's
vaginas.
everywhere, unfortunately. So, this would be like the example of why like hormones are everywhere. How hormones have a lot of different jobs throughout our entire body. And today we're going to focus on the vagina. So as women transition through hormonal fluctuations, changes through perimenopause, menopause, postmenopause, what happens is really the development of the medical term is called genitourinary syndrome of menopause. Now, it used to be called vulval vaginal atrophy. And really, these are just fancy terms to be like your vagina's dry. They changed it to genitourinary syndrome of menopause because they thought that was like more encompassing. But the vagina is very estrogen like appreciative. There's a lot of estrogen there. So we have estrogen all over our body. We have estrogen receptors everywhere. But the mothership, where we find a lot and the most, is going to be the vagina and the bladder. As estrogen drops off and we don't have as much or as enough, and everyone's a little different as to where they will notice this, it's really a matter of when it will happen, not if it will happen. If we're doing hormone replacement therapy, you might not notice, you might not have an issue. Let's just take, for example, someone who is kind of starting to not have periods as often. They're going 90 days, maybe they're going longer. One of the things women start to notice that maybe they wouldn't necessarily talk about is there's no moisture in my vagina. It's dry. I go to the bathroom and it's dry. There's nothing there. I don't know. You go to scratch yourself and you're like, it's dry. You can feel it. And then it leads into all those other things. Like I never have used lubrication with intercourse and there's nothing there. Like it's just dry. That happens because of the decline of estrogen and one of estrogen's jobs. So the vagina doesn't have any, it has glands, but it doesn't like it has to produce its own moisture. It's not, like the eyes, you blink, you've got that. But we have our Skene's glands. So if you're looking at the vagina at the top, you've got Skene's glands up here and Bartholin's glands down here, and they help with the secretion there. But just having estrogen in the vagina helps with moisture. What I always tell them, I'm like, it's an ecosystem. So it's its own little private ecosystem. And if
Right.
you take one thing out of an ecosystem, you can collapse the whole system. What estrogen does is helps to feed the lactobacilli in our vaginas, which is the good flora. We need good flora in our vagina. It helps to keep the vagina healthy. It helps to keep the pH correct. Our vaginas are warm, they're moist. What's to stop any sort of overgrowth of anything? Bacteria, yeast, is the fact that our vagina has to stay acidic. Estrogen feeds the lactobacilli. When the lactobacilli die, they typically produce a hydrogen peroxide when they die off. Hydrogen peroxide is more acidic, so it keeps the vagina acidic. If we don't have estrogen, the lactobacilli don't have food. There's this conversion of the estrogen to a glycogenic, like it's a sugar essentially. And so
Right.
there's less of that. There's less of this food, sugar for the lactobacilli to eat. So they're not there. They can't sustain themselves. So what's there is less. And when it
Uh-huh.
breaks down, there's less pH produced. So then the vagina becomes more acidic. This is a little aside, like like because you do have the dryness, but then this is where women become more at risk for urinary tract infections because now the vagina is not acidic. More likely to get yeast
Right.
infections, more likely to get bacterial vaginosis.
We touched upon that during our last episode. I think it's good to refresh that
Yeah.
because it's a lot to take in. Our vaginas are like these sponges, and as we get
Yeah.
older, they just kind of shrivel up.
They really do. They really they need estrogen. I think the other thing that people forget too, like it needs testosterone as well. The estrogen piece kind of helps more with the moisturizing part of it, keeping the pH. The testosterone really helps like with the muscle part of it, keeping the integrity there. Our vulva has a lot of testosterone receptors, a combination of both. Everyone's a little different, but testosterone can be important to the vagina too.
So, what happens to the lips, the outside and the inner parts of
They get smaller. We call it
it?
atrophy, but it atrophies and it gets smaller. So the length of the actual vagina, the tube part gets shorter. It loses its elasticity. It loses its color. So looking, if you were to look at it normally, like a mucous membrane, like if you look in the mouth, like what that looked like, that nice, healthy, pinkish color starts to get more white. It's one of those things that like women haven't thought about their vagina, like, and it's really disheartening all of a sudden to be like, I'm focusing on my vagina all the time. There's a lot of work to do here.
Using our vagina drops pretty low on the totem pole, and so then it's like, "Well, shit, I'm not even paying attention really to it because 'cause I'm paying attention to a million other things.
Right.
You're not doing anything wrong, you're just living life, and now it starts to shrivel up and turn white. It's not gonna fall out, but it's gonna be atrophied. What can we do to
What
save our
can we do?
vaginas?"
Well, I would tell you, and we had talked about this before, sex. Women who are still having sex pretty consistently, and there's no like, what does that mean? Once a week, twice a week, once a month? But like pretty like consistently having something in the vagina respond better to all therapies, regardless whether you're deciding to just use an over-the-counter lubrication, whether you're using an over-the-counter moisturizer. Those can all be beneficial. They don't necessarily fix the fact that there's not estrogen here, there's not testosterone here. But if you don't want to use hormones at all, that is an option for you. You got to pay attention. What is the pH? Some women are sensitive. Never put anything in your vagina without putting it on your skin first, seeing how you respond, because you have no idea. And then my vagina's on fire. So,
We don't want
there's
fire
we
crotch.
don't want that. We don't want that. But so over the counter to help with the moisture, and you can help balance with the pH. You can do that with over the counter products. Most can benefit from estrogen therapy. If we're using estrogen therapy systemically, so we're like using a patch, a cream, um, even if you're taking it orally, the goal ideally would be that estrogen's going to hit the vagina. It's going to benefit you and you're not going to have those issues. But sometimes it's still not enough where we need to directly give the hormone to the vagina. And it's not a contraindication. It's not too much estrogen. Again, everyone is a little different. Some people that they'll notice that, but vaginal estrogen therapy stays in the vagina. It's working on the vagina. It's not enough. It's not strong enough to take care of hot flashes or night sweats or brain fog. It's really just to help with vaginal dryness and the integrity of the vagina. So you can use like, there's vaginal estrogen cream, which looks like a monostat. You screw the little thing on, put the medicine in the tube, put that in your vagina. Usually what you're doing is you're doing that nightly for 2 weeks. You're re-estrogenizing the vagina, kind of getting it up to snuff, and now we're just maintaining it. So then it's usually about twice a week. Um,
Okay.
and what one of the niceties of the cream is that you can like take some and you can do it externally. So you can put it on the label. Like, so you do have that benefit to be able to do that. They make like a pill that is Vagifem, like it looks like a Pez dispenser, little pill in the end. The same idea, except it's not a cream, and you're just putting the pill up there and it's dissolving. And you're hitting everything, but you can't really do the external with that one. There's suppositories that they make, so maybe a little easier on the insertion piece. Then there's vaginal estrogen rings that you put in for 3 months and they just stay there. So you don't have to think about it. They're a little large though. What's interesting, as we get older, we have hard like dexterity in our fingers and hands, and it's hard to push together. It's an awkward, and putting it in is awkward.
What about making sure you're hydrated in general, like just
Oh,
drinking
yeah.
water?
Oh, yeah.
I mean, that seems like a
Absolutely.
no-brainer, but I mean, it impacts your
Yeah.
vagina, I
It is,
assume.
yes, 100%. And so, like, making sure water consumption here in Colorado, we real 100 to 120 ounces. So you need to be drinking, drink out of a Stanley, and it's the big Stanley, 40 ounces. Like, you need 3 of those,
Uh-huh.
at least
Uh-huh.
like 2 at the minimum.
Right. Okay.
And most of us don't. Hydration can be key. I think people forget about the fact that, like, hey, you've got allergies, you've been taking a decongestant. What does that do? Dries up your mucous membrane. What's your vagina? It's a mucous membrane.
Mm. Okay. Learning that it's all connected. I think important to talk about it again. I don't know how comfortable women are using lube. Part of that is the programming that somehow we're broken if we don't get wet
Yeah.
or we don't get excited enough for our partners or for toys or whatever. So lube's not a bad thing. And
No.
there's the different types, but
Yeah. Well, how many people allow for foreplay?
well, I mean, if you consider the scratching your back before you fall asleep, isn't that the call sign?
To me, it's more of like that spoon where it's like, oh, it's touching my butt. Like there's a lot of rubby, like you know.
Right.
That's the reality, right? The reality is that we are not 20 years old anymore. And some people always have trouble producing. Some people produce more, some people produce less. There's nothing wrong with what how much you're producing or not. But the reality is if we're not allowing for foreplay, then we need like the end we need turned on. And so like what turns you on? So we do need that. And if we're spending time doing that, then maybe we don't need to use lubrication. But most women, it kind of goes right to sex. Like if you even just kissed, like really kiss, make out kissing, that can do it, or no penetration. We're just whatever touching whatever it is you're into. Yeah, that can be extremely helpful. Sex sometimes lasts longer than women need it to last. Like sometimes if a woman has an orgasm prior to her partner, like things like your body just is like, oh, we're done. So lubrication can be helpful in those situations because then as it gets dried out, we just have too much friction. And
Uh-huh.
this is where we start to see increase in urinary tract infections or like just irritation because it just was lasting too long.
Mhm.
It's okay to stop and be like, T, we need some lube here. Or you
Right,
just
right.
preemptive, like it's like pregame. Like I'm just going to put some lube on prior. So then it's good.
Exactly. Then there's fewer interruptions. Shrinking is normal. I heard someone say they use a vaginal insert. What is that? For the muscle
Um,
atrophy.
I would say this would be the realm of a pelvic physical therapist. There are inserts like you can put something into Kegel to tighten your pelvic floor. I usually tell people like a Kegel is the same concept of I have to fart and I can't fart here.
Oh,
It's the
okay.
same muscles. You're using the same muscles because people get really focused somehow on the vagina and like, I can't figure that out. But if you're sitting here, like right now, I just did like five. So like you're sitting here
I'm
and you're
doing them
just,
right now.
it is, and you're just like tightening and then you try to tighten more. Some people would tell you that muscle, like when you're peeing, try to stop the flow of urine. So that would be like tightening the muscle. And so they do make inserts essentially that can tell you the strength, can it, like gives you something to physically go against. There's a lot of different inserts. You can put a vaginal wand in and like pressure points of like where is my muscle in the vagina tight that needs to be loosened because some people have areas that are just the muscle's too tight and we got to figure out ways to get that loosened. Then there's vaginal dilators to help with the manual stretching to get size back. I
Mhm.
would say, for most, it's like if we're having any sort of pelvic issues, pelvic physical therapy, they are amazing. That is their sole focus is working on the pelvic floor. So women who have any sort of prolapse of any kind, their bladder is coming down too much, their uterus is coming down too much, their rectum's coming down, helping to strengthen that. Men you also can utilize pelvic floor therapy. I think the research on it is like people that do and like actually follow through are extremely satisfied with the
Mhm.
results.
A couple more questions. When it comes to like checking out your vagina and getting familiar with it, there's one thing to like look at it, but it's also, I'm guessing, pretty normal to just explore with your fingers, not in a sexual way, but to like, check it out and know where you're at so that if it changes or if
Yeah,
something feels off, you can go in and explore,
right.
just getting
Yeah,
to know
like
your
I
body.
think that that's a thing externally. What does it look like? What does the color look like? Has the color changed? Is there any, am I having new onset itching? Is the itching internal? Is the itching external? When did that start? Does it come? Does it go? Women, we develop weird like skin discoloration. You're always concerned about that area. Unexplained itching. I thought I had a yeast infection and I treated it, it didn't go away. I'm continuing to have that. Looking at your vagina, what does it look like? Knowing what my skin looks like normally, and having that evaluated to make sure it's nothing like that. It isn't anything of significance.
I think that would bring some level of comfort Because when we don't understand something, we tend to make up stories of what it could be. So
Mhm.
if we haven't taken the time to get to know our bodies or especially our vaginas, something must be wrong. Or my vagina doesn't look the same as I've seen in movies or pictures of other vaginas. And, they're like
Individual.
fingerprints. I'm
Yeah,
assuming that
yeah.
everyone's looks a little
Everyone's
different.
different. Everyone's
And
different.
and I guess the reality too is when it comes to having a relationship or intercourse or an encounter with another human, they're not paying attention to your vagina like you're paying attention to your
No,
vagina.
they're not looking at it. They're not really y no. Yes, correct, like, and some of the things are subtle, and some of the things you need to, like, look a little more closely. What am I looking for? Like, that's why you should have a yearly well woman exam. Ever since we changed the guidelines and we aren't doing pap smears, every single year, women don't go. There's more to a well woman exam than just a pap smear, and so when
Right.
you're doing a head to toe and you're feeling people's thyroid, you're listening to their heart, their lungs, you're assessing their skin. If you're doing a pap smear, you are looking at the vagina. Like, do we see anything abnormal? Like, does everything feel normal shape and size?
Highlight the takeaways that it's totally normal for your vagina to shrivel up like a sponge or a bad pastry, but there's hope because you can do something about it.
I think that's the biggest thing. We should be doing something about it. Many women will say, like, well, I'm not having sex anymore. Yeah, but you might want to. And let's just put that aside. Let's just say, like, no, so that's not happening. It's like we want to make sure that we're not putting you at risk for increased urinary tract infections. One of the best preventions as women get older is using vaginal estrogen to help maintain the integrity of the vagina, because as we get older, urinary tract infections don't present the same way as it does as a 40-year-old versus an 80-year-old. And people can die. Like, you can get really sick and septic. And it
Right.
can be a simple urinary tract infection.
And obviously labs, right? It always goes back to your lab work. That's a part of the puzzle of knowing where your estrogen levels are or knowing
Yeah.
what's going on with your body to also help protect your vagina. Get your labs and then take a look at it. Know where you're at. Know what it needs. Become familiar with your own vagina.
Yearly exams, or something's
Mhm.
like, this doesn't feel right, something's off. I'm having ongoing itching that's not going away, that should be evaluated. I'm having ongoing, like, my discharge, or I've noticed discharge has changed, or it smells funny. Discharge is discharge, and we all have it, but if it has an odor like that you're not used to, that's abnormal. So we always want to check on that as well too.
What about bleeding? Is it common for bleeding after sex?
Bleeding after sex, that's a discussion. It depends, like, how often is that happening? Does it happen all the time? Are you still having periods? Where are you on your cycle? If you're postmenopausal, then, like, that needs to be evaluated. There are a lot of times it's more anatomical. Women develop, something on the cervix that's being irritated by a penis, and so it's causing bleeding more often than not.
Awesome. Thank you again for more information on our vaginas. And as we age, we just need to take care of them and don't be afraid of them.
Yeah, and don't I think that's the thing is, like, we put moisturizer on our skin, it gets dry, same concept.
Right, right. So your face, just a different type of moisturizer that
Yeah,
you're going to put
just
on your
exactly.
face. Okay.
Exactly.
Awesome. Well, until next time,
Alright,
thank
guys.
you.
Take care.